Thank you very much. I know that's much appreciated, and it is. I'm hoping everyone can hear me. So if I don't see any chat, that if there's any problems, I'm going to carry on. It's an absolute pleasure and a privilege to be with you all today at what feels like a really important event, and thanks to colleagues at IS for pulling all this together. I appreciate my slides are probably small, and you can obviously get copies of them afterwards, but just to draw attention to a couple of things on this first slide, this is what we call our trauma-informed flower, and this is our attempt to kind of pull together all the elements of a trauma-informed approach into one image, because I'm a very visual person and that's how I think. So I hope that'll work for you too. But I'm going to unpack this over the next couple of minutes. I also want to just flag our website, our new website we're very excited about, which has a lot of resources, and I'll go through those as we go forward. Thank you very much. Could you go to the next slide, please, Joan? Okay, I guess just to set the context, why do we have a national trauma training programme? Could you just click on one more thing, Joanna? Thank you. One is an increased recognition over the last 20, 30 years of the prevalence of trauma in our societies, unfortunately. The data that's up there, and I appreciate it's too small for you to read, but it comes from the 2020 Scottish Health Survey. And that is the first time we've gathered in Scotland specific data around people's experiences of adversity and trauma in childhood. And that's just I mean, there's a millions of figures here, but just to pick out that a third of adults are reporting that in childhood they experience physical abuse, and about a quarter of our population are reporting being exposed to domestic abuse. So we know that this is common, sadly. And COVID has just, as everybody has emphasised, has just emphasised this. This work began before COVID, but has become even more crucial after COVID. The tree, sorry for all these botanical references, but the tree on the rest of this slide is again a sort of pull together of all of the evidence that we have across of the impact of trauma and adversity across the lifespan, that tends to be captured around impact on mental health, physical health, and a range of social outcomes. These are not inevitable outcomes, and these are things that happen if we have, as it says in the slide, absence of other protective factors. And one of the other elements why it makes this approach so important at the moment is we now understand so much more about what these protective factors are, and therefore we can use them in the way we plan to deliver services. And again, the golden nugget, the crucial thing that hangs all this together is that we know that the recovery and support for recovery for trauma is around relationship. And again, this is where COVID comes in, because the way that our relational networks have been disrupted, and therefore the risk that we don't have as much access to the buffers that keep us well in the face of adversity and trauma are not with us at the moment. So again, that amplifies the effect of trauma. Could you go on to the next slide? What we've done is try to pull together all of the horrible things that meet the criteria for being traumatic. And although we completely appreciate that some of these particular experiences have specific impacts, and we need to be able to respond to individual needs at a very individual level, but particularly when we're thinking about a trauma-informed approach, what's more important is what's in common with all of these experiences, and what's in common with what we can do to ameliorate and mitigate these things. Because what we know is if we subdivide, then people fall down the gaps in those silos. So thinking about the commonalities of them at a trauma-informed level is the most important. So it's really any of these things, not an exhaustive list, sadly. Could you go forward another slide? So what would a trauma-informed nation look like? Now, generally in the literature we talk about 4 or 5 R's. In Scotland we've gone one better, and we've gone for 6 R's. And we've already covered 2 of them. So one is realising that trauma is prevalent, and secondly is recognising that trauma has an impact and a barrier to some people's life chances. So then what are the other R's? So we need to be able to respond competently and confidently with all of this in mind. We need to be able to do no harm, to support recovery, and crucially, remove barriers that some people experience in accessing our services. Because the people who need our services most often find them hardest to engage with. So a trauma-informed approach will be very thoughtful of those barriers. Another area is recognising and appreciating resilience. I had the great fortune of being a frontline psychologist delivering trauma therapy to survivors of domestic abuse and sexual abuse for 20 years in the early part of my career. And I spent most of that time in utter awe of the people I met in terms of the resilience and what they brought to their own recovery and how. So absolutely being that at the help. And that's not a typo in the next art. Real relationships matter. These are a relational approach is the counter. It's the vaccine that we need to, in terms of bringing a trauma-informed approach. Could you bring it forward one more thing? The last R is resist re-traumatization, and that can feel a little bit technical and a bit complicated. But basically, it's saying that if you've experienced trauma, that's the lens in which you often view relationships. So being able to be aware of that, we can then offer people an experience that's the opposite of a traumatizing relationship, that offers the opportunity for a different experience of relationships. And if you bring it forward one more thing, we'll start to see the features of that. So that's a relationship that brings safety, choice, collaborates, empowers, and crucially is built on a genuine trusting approach. And sometimes that trust has to be earned. We can't always just assume it. Could you go forward another one? Thank you. So this is the ambition that the National Trauma Training Programme set itself. And just to it's loads of words, don't worry about them. But the crucial thing is that we can support recovery, that we can address inequalities, and we can improve the life chances of people affected by trauma. So if you jump forward another one. So what is the National Trauma Training Programme? It's kind of bookended by two kind of resources. So one is the Transforming Psychological Trauma Knowledge and Skills Framework. That sets out what staff, what workforce, anybody in the workforce, paid, unpaid, in any sector, need to know in order to be able to do their job well. And that's not about necessarily doing their job differently, because they still have a job to do, but it's about being able to think and bring a lens to their practice that accommodates the needs of people with trauma, who've experienced trauma and impacted by trauma. And secondly, is the other bookend is the trauma training plan. That's the implementation tool that helps us to think about, because I'm just about to talk about this, that training, although important, isn't sufficient to be able to take this work forward, this ambition forward. If you go forward one more, thank you. What we did is we split the workforce into 4 levels. A trauma-informed level, that's for absolutely everybody. Trauma-skilled, that's for people who are working regularly with people who are affected by trauma, who need to be able to just think about that lens even with a bit more detail. And trauma-enhancing specialists are people that are doing much more specific trauma-related recovery or other advocacy practice work, and are not so much the focus of this, but it's a crucial part of the whole package. If you go forward again. So how do we do this? Go to our website. This particular PDF has all of our resources, a link there, but it's also linked out as a link to absolutely everything we've produced. And at an informed level, if you go forward another couple of clicks, thanks, there's some animations and supported filmed workshops that will help you to take your team through a trauma-informed lens to your practice and bring alive all of those principles that I've just alluded to. And if you go forward another
1 minute to go, Sandra.
Thanks, Simona. There's e-modules that will help you, and just a few more clicks forward and I'll get through. There's various films that you can access as well. Next slide. What I said earlier was really important in terms of training is only one part of all of the elements that we need to be able to pull into this. And I'm just going to pull out a couple here. One is shared power with people with lived experience. In all of my years, never has anything I've done with people with lived experience ever done anything but make this infinitely better. Let's work together. And let's think about our staff groups as both, you know, this is not them and us. This is not, you know, we're all in this together. And leadership is key, because leadership set the context. Could you go forward another one? So we've got some resources around leaders training as well. So I'll let you explore that on the website, and then go forward another one. I think we're nearly there. There's some other resources that we have. Again, all of this is outlined on our website, and these are other things that support us at a national level. And my last slide, and one more click on. You know, these principles are are important in terms of how we work with others, how we work with people we serve. They're also important of how we work with our colleagues and how we work with each other. A trauma-informed workforce is going to take all of these principles, and I'd really like you to think about those as the core thing that'll help us through this whole endeavour. So thank you very much, and I hope I'm not too far over. Thanks, Iona.